Are you a family member?
Yes.
Okay, can you tell me what happened?
We were like getting ready to go out to eat, and
Okay.
my dad started acting like this.
Okay. And what's your dad's name, honey?
Kate.
Kate. Has this ever happened to him before?
No, this is the first time.
Alright, so. What's his name?
Kate.
Kate, can you hear me? Okay, well, so he's looking at me. Alright, so, and he's apparently breathing, so I'm going to say he's got a patent airway. He's unable to respond, but he is breathing. The skin is going to be pink, warm, and dry at this time. I'm going to make the patient a high priority. Kate, I'm going to give you some O2 to help you with your breathing. Has this ever happened to your dad before? Do you know?
Never happened to him before.
Alright, so I'm going to see facial drooping to the left side of the body. I'm just going to check your dad office. Kate, do me a favor. Can you give me a big old toothy smile? Okay. Can you give me your arms?
I can't do it. This is camera. Okay.
Alright, Kate, I'm going to take your arms. What I need you to do, I need you to hold on up for as long as you can. I'm going to let go in 3, 2, 1. Alright. Can you repeat after me, Kate? Can't teach an old dog new tricks?
Tricks.
Okay, alright. How long's your dad been like this?
About an hour.
About an hour now? Alright. How far is my closest stroke center?
Closest stroke center is 10 minutes away.
10 minutes away. Alright, so at this time, I'm going to put the hospital on alert for a stroke center. This patient is a high priority rapid transfer due to the patient having a stroke at this time. Has your dad ever had a stroke before?
Nope.
Okay. Is your dad on any medications?
Yes.
Do you know what he's on?
Lopressor.
Low pressor? Anything else? I'm sorry, what?
I just repeat what you said.
Low pressure?
Mm-hmm.
Anything else? Okay. And has this ever happened to your dad before? First time. Okay, and how long has he been like this? You said an hour?
Yeah, just about an hour.
Does he have any other medical history I need to know about?
He had a heart attack a couple of years ago.
Okay, and did they do anything for his heart attack?
They gave him like a double bypass.
He had a bypass double? Okay.
Mm-hmm.
Okay. Alright, do you know if he had anything to eat or drink today?
He had a sandwich like 2 hours ago.
Alright, so I'm just gonna check him out and do some vitals. So what was he doing before he came like this?
We were just like getting ready to go to the store.
And when was the last time you saw him normal when he wasn't like this? When he was like talking and walking and having a good time?
Right after lunchtime.
Right after, and what time was that?
Like 11.
Okay, alright, so what I'm gonna do is I'm gonna check out some vitals on him. I'm gonna package my patient, like I said, we're in the back of my truck, we're en route to the hospital. How far is my hospital now?
Closest hospital is 10 minutes
It's
away.
still 10 minutes out? Okay, alright, so we're in the back of my truck, we're heading to the hospital, and I've already put the hospital on stroke alert.
Mm-hmm.
I'm just gonna take their vitals. Do you know if your dad's vitals are usually pretty mild? Do you know if his blood pressure's?
He's usually high.
Okay. My vitals will be easy to find him.
Mm-hmm. Except for blood pressure. Except for the blood pressure.
Except for the blood pressure?
Mm-hmm.
Alright, what are you gonna give me? I got 102 over 68.
It's 220 over 100.
Okay. And Kate, I want to listen to your lung sound, so each time I touch you with my stethoscope, I need you to take a deep breath for me, okay? Okay, breathe. 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 Okay, I'm just going to try to reach under here. Breathe. Okay, a couple more times for me, okay? Breathe. Breathe. Lean forward a little bit for me. Breathe. And breathe. Alright. My lung sounds are clear and equal bilateral.
Mm-hmm.
Alright, so we're gonna do. Give me my pen real quick.
Put it in your pocket.
No, that's my pen. Damn
I
it.
think that is a pen light.
No, wait. Oh, good, here's one. Look, this bystander had a pen light. Alright, do you know if your dad has any light sensitivity?
Nope.
Okay, alright, so what I'm gonna do is I'm gonna shine a light in your eye, sir. I need you to stare at my forehead if you can, okay? Okay, no reaction there. Okay. Only I have reaction in the right elbow. Oh, good. Okay. Pupils are not pearl at this time. Skin is still pink, warm, and dry. All right, so what I'm gonna do now is I'm gonna check your dad. I'm just gonna do physical exam. Do you know if your dad fell today and hit his head at all?
He did not.
Okay, I'm gonna rule out C-spine at this time.
Mhm.
Okay, what I'm gonna do is I'm just gonna check you out kind of like a physical at the doctor's office, okay? So do you have any difficulty swallowing, any swollen glands? All right, trachea's midline, I see no JVD, I see no stoma, no medical alert tags. Checking for subcutaneous emphysema. Can you take a deep breath for me, Kate? Does your dad smoke?
No.
Okay, can you take a deep breath for me? Have equal expansion. See any other respiratory problems, asthma, or anything like that? All right, I'm gonna check for pulsating mass. Any problems with your dad's stomach with, like maybe GERD or ulcers? Okay, do you know if he has normal bowel movements?
As far as I know.
Okay, all right, so I'm just gonna push on your stomach, honey. Just tell me if it pains. Just make a face or something if it hurts. Any pain? No pain? Okay, no pain in the abdomen. Any problems going to the bathroom, frequent urination, do you know, or if it has any burning sensation or anything? All right, I'm gonna check their legs. Can you feel me touching you? Okay, no pain or weakness? You feel me touching you? Joint pain or weakness? All right, no feeling on the left. All right, no pedal edema. I'm gonna check for posterior tib. Do I have a pulse on the left or no? Slightly, okay. Dorsalis pedis. If I'm present, can you feel me touching this? Shoes will be off. What foot do I have? What foot do I have? Okay, let me check your arms. Any pain or weakness? Feel me touching you? Can you feel me touching you here? Any pain? Nothing? Okay. You're feeling in the left arm. Radio pulses are equal and present. Can you feel me touching you? Do me a favor, Kate. Squeeze my fingers if you can, as tight as you can. Okay, you can let go. So the field impression of my patient is they're having a stroke. Makes my patient a high priority rapid transport. And am I at the hospital?
Mm-hmm.
This is Kate. Forgot to ask how old he is.
66.
66-year-old male with no history of strokes. Patient was found like this about an hour ago by his daughter. Last time she saw him normal was around lunchtime. The vitals at this time that I found, I placed the patient on 15 liters high flow O2. The only medication the patient takes is low pressure. Did have a heart attack 2 years ago and did a double bypass. I got 102 over 68. I got a pulse of 88 and a respiratory rate of 16 at this time. Skin was pale, pink, warm, and dry at this time. The stroke has been for roughly probably more than an hour. She said the patient had been like this for an hour, nothing prior to, other than the heart attack 2 years ago with the double bypass done and the only medication of being the low pressure. Vitals remain stable. Do you need anything further from me?
No.
All right, my station's complete. So the only